Sorry about the rain if you're in Michigan, but here in Maryland, it's quite nice and there's a decent hope for a decent weekend. So I hope it is, or I hope you have one as well, but thanks for being here. Let me remind you that this is being recorded. It'll be available later this afternoon. If you have questions during the webinar, type them into the chat box when they occur to you, and we will save them to the end and get through as many as we possibly can. Kelly has put a lovely discount code in the chat box. So if you're going to use this for continuing education, copy down that code now, although you will see it again, I think, in the follow-up email, but just so you have it. And I think that's all I've got. I guess one other thing, Dee is going to be here next week again. So this is a two-part series. So I think it'll be pretty much in-depth presentation, because he will have a whole 2 hours total to enlighten all of us. So Kelly, would you like to introduce Dee? And I'll stop talking now because I've been accused of talking a lot.
Sure. All right, today we have Dee Eddington and Jennifer Pitts. Dee Eddington is the founder and chairman of Eddington Associates. He is the founder and professor of the University of Michigan Health Management Research Center and was the director of the center until June of 2011. In addition to his research and teaching, Dr. Eddington has spent 25 years in academic administration. Trained in mathematics, kinesiology, and biochemistry, Dr. Eddington received his BS and PhD degrees from Michigan State University and completed his MS at Florida State University. He did postdoctoral work at the University of Toronto and taught at the University of Massachusetts before coming to Michigan in 1976. And Jennifer Pitts is the co-founder and chief strategy officer at Eddington Associates. She has more than 20 years of healthcare research and consulting experience in both academic and applied settings. Before joining Eddington Associates, Dr. Pitts spent 12 years with Pfizer Health Solutions, Inc. as the director of the Outcomes and Analytics Unit. At PHS, she was involved with the design and evaluation of health improvement programs and community programs at the local, state, and federal levels across the United States as well as abroad. Jennifer also previously held positions at UCLA's Division of General Internal Medicine and Health Services Research, Kaiser Permanente's Organization Effectiveness Division, and at Casa Colina Medical Rehabilitation Hospital in Pomona, California. And we're very pleased to have them both here today. We're going to start off with Dee.
Well, thanks to both of you. Thanks for inviting us. Jennifer and I are looking forward to this, so we're going to have a good time. We're starting out with shared values, shared results. And that is one of our themes in our new book, Beyond Zero Trends, that will come out in probably late July. We have 3 themes, and this is the first one: shared values, shared results. And I think that's really where wellness has to get to, and companies in general have to get there. The second theme, and we'll talk about that next month, positive health. And that's how do we get beyond 1 to 2 risk or 0 risk and get into really a positive way to look at life and live. And the third theme, we will touch on it in both sessions, but the third theme is measure what matters, and that's an important theme for us. And so we're working on those. The first 35 years of work that I did, and Jennifer can tell about her first years, and I was starting when she was just around, getting out of kindergarten. this 35 years is we worked on zero trends. I use it health as a serious economic strategy. And I didn't really like that because I thought it was a human resource strategy when I started, but healthcare costs really became an issue in the late 70s and even the early 70s. So I switched from, I started in 77 in this particular field after several years of working with rats and helping them live longer with better fur. I just switched over to humans, doing the same thing essentially, but don't check the fur now. So but we made an economic strategy because I thought that's what companies were interested in, and it turns out they were. They weren't necessarily interested in a health strategy, but an economic strategy. And so we started with no data. We had it's an idea of the risk factors that were well known. Some were as early as Aristotle and Plato and Confucius. All had the idea that there's something about life that really matters and something about life that does not do so good. So we just started with those risk factors and the risk factors from Framingham and then from Tecumseh and say that let's look at the risk factors, and you know all the risk factors. I'm not going to take the time to go through those. But we found that the individual risk factors were not nearly as interesting as the combinations. And so what I've done here is low risk is our typical public stratification of low risk is 0, 1, or 2 of their typical risk factors. And if you're less than 45, 3% of the population will have one of those 5 diseases in the title there, the heart disease, diabetes, cancer, bronchitis, and emphysema. And if you're greater than 65, 18% of your cohort will have one of those diseases. If you're medium risk, that's what the data are, and then if you're high risk. So if you're 45 to 64 and low risk, 10% of your group your cohort has one of those diseases. If you're high risk, 56%. So that was the first thing that we did, was to make sure that those risk factors were related to disease. So that wasn't brand new, only the stair steps were new. People had not done that before, so that was a new thought about the combinations of risk. And even now people worry about high cholesterol. Well, maybe that's still a low risk if that's all you have. And then we looked at the natural flow, and this took some time to get these data. But the numbers in the rectangles on the blue rectangles, like the bottom right-hand corner, put my cursor over there, 27,000 people, 27,951 people are low risk in year 1. And up the upper rectangle blue, 4,691 are high risk. And so that was good. That many people were low risk, 64%, and that's not too far from most. The range is from like 50% low risk up to, say, 70% low risk in the first year. But then if we waited 3 years and then went back and measured them again, and now 61% are low risk and 12% are high risk. So there's a natural flow of somebody away from low risk. So if that's all we had, those 6 numbers for the medium risk included, we wouldn't know what happened to the population. But if the green arrow is coming down from high to low and from high to medium, show you that some people got better. They went from high risk to low risk, or high risk to medium, and medium to low. And that's good. But then at the same time, there are people going the other way. The red lines are going high. So that's the natural flow. And everyone in the planet is on one of those 9 lines. The other 3 lines are, for example, at the bottom, the people who were low risk at time 1 and stayed low risk. 77% of the low risk people stay low risk over 3 years. 50% at the top, 50% of the high risk people stay high risk. So there's 9 lines there, and you figure out what bar you're on, which of those rectangles you're on today, and then there's 3 choices. You can either not get worse, or you can get better, or you can get worse. So that's a natural flow. That will happen, and that was really important because that's our benchmark. If you can't beat the natural flow in your population, then you probably should get into real estate or something. It's a better deal. And then the other one that probably the third slide I'm going to use, there's 200 slides here, but this is only picked out 3. The low risk people by age group, you see the age groups along the bottom, and then on the left hand side you see the annual medical costs, and on the right hand side on the bottom you see the low risk, medium, non-participant, medium risk, and high risk. So that's the low risk people. And as you age, even the low risk people will stay low risk. Their costs go up. And these are non-participants. Non-participants are a mixture of all the risk factors. So you don't know much about them other than they didn't participate, but you know their age. You actually know your age and gender. We could do this for men and for women. Get about the same diagram. Then there's high-risk people. So that's the natural flow of Americans, and the red line shows you the actual natural flow. So as people get older, they get higher costs, and as they get higher risk, if you're 45 to 54 and you get higher risk, your costs go up. And we haven't seen a change in that line all the time that we've been doing this. So that's a natural flow, and our challenge then, can you beat the natural flow? And that's one of our major learnings over the time I was at university. We had 34 people in my research lab and studying these things. So we did a very systematic trip through the risk factors and cost factors. And this is something that we put together as our model in 1981, and so it just kept it all the way through 2008. A very similar model. You start on the left-hand side with health and disease management programs, and then lifestyle change. We all go through that, all the exercise courses, weight loss. And supposedly we get healthier people. And then supposedly they are better employees. And then there's look at the gains for the organization. Now gains could be negative or positive. And then these are the topics on the right-hand side. Those are the topics that we've measured. And we have good data on almost all, not as much on social responsibility and company visibility yet. So we didn't get much of that, but we got a lot on productivity, healthcare costs, disease care costs, and health status. Now, the way wellness and medicine approached it, wellness approached it with behavior change. So there's still some people in wellness think this is all about behavior change. And there's some people in medicine think this is all about treating disease. Well, that's what's happened. That's the way this field, both fields, wellness or well-being and treating disease, that's the way we've worked. And unfortunately, the data haven't been very good. I mean, there's a lot of questions about our data. Have we really made a difference? And I think that natural flow that I showed you there with that red arrow shows we haven't made a difference in population. We probably made a few differences in individuals, but not in the population. So my summary, after all the work at the university, the 3 things that I recommend is, first of all, don't get worse. And you can't get better till you stop getting worse. So a lot of people get upset with that, but then I say, well, you don't understand mathematics very well. You can't get better until you stop getting worse. And then help the low-risk people stay low risk. I think that's where the actual financial return will be. And then but you also have to help the high-risk people move to low risk. And so those are at least 3 things that wellness can be about. And medicine has what they need to get done. But I'm focusing on 30 years at university. We didn't lose sight of we worked for organizations. We didn't get into communities. We didn't get into schools. We stayed focused on the work site. And so that's and usually the primarily the employees of the work site. So we wrote Zero Trends at that time, and I had a good opportunity to do that. I spent the summers in New York at Skinny Alice Lake and the Finger Lakes, and good time there. But it took more than that. It took 2.5 years to write that book. But that's our vision in the middle there. Populations of people live and work with a thriving, healthy, high-performing, sustainable workplace and workforce. That was sort of the goal of Zero Trends. I would cheat it a little bit because that's my vision. That's not what we proved in Zero Trends. But that's where I thought we had to go, and that's why we're writing this second book now after 6 more years and 50 more publications and another couple hundred presentations. So that was before 2013 before. Now with Beyond Zero Trends will come out in 2014, and here's where we think we're going. I think we'll continue in this field to work on business strategies to cope with disease, health, and well-being. So I think that will continue because that's what we've been doing. And we're getting pretty good at it. We all know there's ways to improve, and that's the way life is. There's always room for improvement. But there has to be room for celebration, too, that we really feel good about what we've done. But I think we have to add building a thriving, high-performing, sustainable workplace and workforce. And this time, I'm serious about it. This is what we have to do. This is our work ahead to prove that this works. You hear a lot of things in the popular press now about thriving. You hear a lot of things about optimism, creativity, gratitude, and so forth. And that's good. I think it's good for individuals. But the issue is it good for the organization or the population as well? And then that's where we have to figure out how to show that that's right. Another thing we learned in the 30 years that I worked at university, here are the barriers. And I found in all the people I've talked to, and there's several hundred presentations, I talked to a lot of people out there, and they talk about why they can't get high-level participation without paying them, and why aren't people not adopting? They earn the classes, but they don't adopt the behaviors for very long. They do them for almost everyone loses weight or starts to exercise in 12 weeks and even a year. But that's only a third of the way through. You got to do at least 3 years before you can really say you've changed behavior, I think. So these are the same things that senior leadership, they feel like lack of support, operations, there's not a supportive culture, they didn't communicate to us. The people, individuals say, well, I don't understand. Why are we doing this? What do you want us to do, and how will we do it? And people lack self-efficacy. You give them, sometimes wellness people give them something they can't possibly do, like walking 10,000 steps every day. And some of the crazies will do that, and probably all the wellness leaders do it, and they think everyone should do it, and they don't look around at the real population. But lack of time and convenience, that is a real one, and that's just not a made-up one. None of them are made up. But lack of time and convenience is really something that people talk about a lot. And recognize the strengths. I think we don't talk about strengths very often. We don't give people positive recognition. In health risk appraisals, I did 12 million of them when I was at the university, and all we did was tell them about what they could do to improve and what they're doing wrong, so to speak. We didn't talk about the positive things. And I think anyone knows that you really start with people's strengths, not with what they're doing wrong. And quality assurance, and that's the measurement. I don't think we gave people enough feedback. We really fell into the habit of annual reports, and annual reports are no better than annual performance reviews. People forgot what happened. And there's no shared values or shared vision or shared results. And I think that's really, really open right now to a lot of transparency. I think we all agree that the senior management and the stockholders have a very good issues around shared values. They share values to make money, and that's their goal. So they have great shared values. But when you look at the senior management and the workforce, the team members or stakeholders, whoever we want to call them, employees, there's not a lot of shared values there. There's some, but they're not very little financial values, but there are other values. But there's a lack of shared values there. And in the communities, there's a lack of shared values between management and the community. So a lot of people, a lot of companies just don't have a very good view with their relationship with their communities. And I like this. This is, I went to England. Well, I go quite often, but I went to visit Dane Carroll Black because I know they're doing some things in England that I think we should be doing here. And when you get off at Heathway, you get off the flight, and you go down to the train that takes you into the city. This sign was right there. That was exactly why I was there. I'm going to change my way of thinking, embrace new points of view. And I think that's really where we are. And by the way, that's my hand there on the picture. Now, I think that, I showed you what we had done before on the 81 to 2008, but here's a 2013 view. Now we start with the vision and strategy, and then we go to supportive environment and culture. That's just systematic. Then we go to thriving and high performing. It's getting to the culture systemic. Then we champion companies. Here are the gains of the organization. Now these first, health status, economics, health, personal economics, that's new. We need to do that, and I'll briefly talk about that probably next time. Health economics, that's what we've been doing for all these years. Disability, short-term, long-term disability, time away from work, absenteeism, presenteeism. Those are ones we've been doing for all 35 years. The new ones, we're going to be much more about recruitment and retention, because companies tell us that's a much bigger expense than healthcare costs if you have high turnover, because you have to replace the person, you have to search for them, you have to replace them, you have to train them. It's very expensive. And we'll look at engagement. What's really engagement? Not just doing a bunch of more programs, but are they really engaged? In fact, if everyone goes away, will they still be involved? Will they be involved without paying them money? Now you're talking about people that are engaged in really what we want them to do. Social emotional, we'll talk about that. Jennifer's going to use that particular part. I'm to go halfway, and then she's taking it from there. Happiness, I think that's a major goal for companies. And I have a couple of CEOs that said that's where we want to go. We want happy employees. And then sometimes happiness is not a good thing, but they go to quality of life. Well, maybe what's a good quality of life? Company social visibility, and then overall is a company employer of choice. So those are the measures that we're doing. It still goes through the same pillars. The 5 pillars are still going to move the people through the vision, environment, thriving people, company, and measure good outcomes. So we're still going to use that. We're integrating the pillars into the systematic thinking. We also know we can't do it by ourselves. Wellness and well-being cannot act in isolation. They need everybody. This is a team spirit. This is a team program. It's an all-in enterprise. Everyone has to get there and work. There's all stakeholders, production staff, engagement, talent, marketing, senior leaders, communications, everyone has to be involved. And so, because we're trying to work for a best place to work or employer of choice. And we know that the whole is greater than the sum of its parts. Wellness, people, well-being should not take it on individually because you have a lot of heavy people in the organization. That's everybody's responsibility, not just wellness. Safety directors can't take it on if we have an accident. Can't take it on as their problem. It's somebody else's problem as well. It's everyone's problem. So we haven't done this very well. I think in general, we haven't done it. I'm sure there are places that's been really a good message for everyone, but in general, we have not used the whole organization. This is our process. This is a systematic process. The senior leader was this strategic process. The second S is systematic. There's 4 S's, by the way. So we engage in pre-program planning. We talk to the CEO about his goals or her goals. And we have an executive steering committee. And then we're continuing to feed data over into our corporate position. This is our measurement system. So in the first stages of this process, we get things into the metrics and the measuring system right away. The first thing we do after that, the next thing is conduct organizational health assessment. And so we have an environmental audit, we have perception and culture audit, and we have focus groups and qualitative, and all those data goes in. And then we look at where are the strengths in the organization, what's the present gaps, where are the strengths, and then we try to encourage the strengths and fix the gaps. So then we have some work teams that are going to go up and help us fix the gaps. We start with this, but we also do a wellness audit. And does the wellness program really are the wellness people in tune with the organization? Or are they often as a barnacle on a boat and doing something else? Then we train all stakeholders, and that's in the why, what, and how of what we do and all goes into the measurement system. And then the continuous measurement system, we'll talk about that. Jennifer will wrap up with that. We have it as a GPS. GPS in your car, you say where do I want to go, and how it tells you how you get there, and you figure out where you are now. This sort of comprehensive. We feel that you have to know how you're going to measure it before you get started. I mean, you just can't start and then try to figure out how to measure it later. So foundations are the 5 pillars. So we evaluate the foundations, and we'll talk about how we evaluate each of the foundations as we go. And then there's process and getting the employees engaged, so forth. And then our measurement output, that was a process over here. And then our measurement, we measure the psychosocial impact, health and safety behaviors, health status, life satisfaction. Then we look at relationships. What's the relationship between supervisor and colleague? That is really an important area, as all of them are. But the supervisor, there's some books out like The Bad Boss Can Make You Sick, and maybe A Good Boss Can Make You Healthy. I don't know, I haven't seen a book like that, but it could be written like that. Yeah, we could write our book like that. Family and friends, have we make a difference in family and friends? Is there a difference in community relationships? And we go from short-term, like, early indicators to lagging indicators. And then we look at the organizational impact, the productivity, work satisfactions, utilization, healthcare utilization, disability utilization, EAP utilization, financial resources, and then we feed it back. So that's our measurement outcome. And so as we go along, everything feeds back into the system. So we have that. We know where we're going, and we know that knowledge comes when relationships are connected outcomes. How do we connect all this? And then how do we feed it back? That's another thing I think that we've missed in this field. We've not fed information back enough. I mentioned it earlier about annual reports. We need weekly, monthly reports. There's somehow to get people thinking about how we're doing. Because if not, they just forget about it. Well, this is our journey towards a shared values company. Are you working in a shared values company? This is a typical sequence of events for wellness. Usually starts out with a clear vision and metrics with the senior leader and the supportive culture environment. That's the first 2 S's, strategic and systematic. Then wellness has typically worked in this field in the middle. Prevention of wellness, risk management, and then disease management. And sometimes care management is in here too, but that's usually a medical, but sometimes wellness does that too. So that's our systematic where you really get it, systemic where you really get it into the culture. And then measuring over on the right-hand side, we shared values, the positive returns, and not just financial, but a lot of other positive returns, the way people interact with each other, the quality of life, do they feel it's a good place to work? Workforce, is the workforce engaged? Are they thriving? Is the best place to work? And then that's where we get into sustainability when we continue to feed it back to individuals. So that's the model that we'll talk about, and how do the pillars impact that model. So the first pillar is senior leadership, and we talked about that somewhat, and I'm going to go through these relatively rapidly. You can get the slides. If you have Zero Trends book, a lot of this is in there, but about a third of it's in there. This new other stuff will be in the second Zero Trends book. So that connect the vision to strategy. It measures what are the measures? When we go to a company, we ask the CEO, what would you like to know? I've seen too many wellness people figure out what they want to measure, and then they go to take it to the CEO, and the CEO said, I really don't care about those things. Here's what I want. So the wellness people really need to connect more with management, so you're measuring what matters. And that's where we get to measure what matters. Are you measuring something that's really important for the organization? The vision, here's a vision that's really from one of our clients. Sustainable culture of health, where quality of life, well-being, empowerment, engagement are all thriving. So how are we going to do that? So that was our challenge. What are we going to put in place to give the CEO those measures? I'll tell the CEO and other senior leaders, are we making progress towards that? And I like that vision, and that's a challenge. It's not about how many people are overweight, how many people are smoking, how many people. I think those are tactics, and it doesn't give wellness the credibility that it needs. We need a higher level of credibility. So pillar one, senior leadership. Now these slides will show you senior leadership. We know what they do, we know what they continue to do, but here's what we're going to measure. Did they get increased awareness because they were involved? Are there more motivated employees? Do they understand shared values now? Because the shared values has to start with the senior leaders. Is there a clear mission and metrics? So that's how the senior leaders impact, over on the right-hand side, impact program impact. And that's how they make their program impact by what they do. We measure it. The second pillar is around senior operations leadership, or HR typically, but it could be the wellness. Wellness person can have this responsibility. You do an organizational health assessment. You find the gaps and the strengths, train all employees, and this is backwards. It should be why, what, and how. Conduct a wellness program audit. And we all know that you can work like crazy, get people to help people change, and then you go back in the same environment and they go right back. So recidivism is really high in this group, in organization. And how does pillar two, how do they make a difference in the outcomes? The supportive culture and environment. In my opinion, and biased as it is now, I think that is really the secret. Have a supportive environment and culture, so it becomes the norm, and just the way we do things around here. We're very safe. We don't expect to get injured because we know we're safe. We really pay attention to safety, and I think we need to get health to that same thing, wellness. Is it part of the culture? Do we expect everyone to be healthy? Create a supportive environment, employee health in the environment, the supportive culture. Reduce barriers to self-leadership. The barriers we talked about earlier. I mean, that's the best place to start, with the barriers. I don't talk about barriers, but what are you doing that you're really making a difference in those barriers? And the third one is self-leadership. And Jennifer, I think you're going to take over here.
Yeah. Can you hear me, Dee?
Yep, I can hear you.
Okay. And hopefully everyone else can too.
So you're going to create winners now with them, Jennifer. Okay.
Right. So building off of the culture and the ways that we've extended looking at the pillars, we're really starting to ask what is it that helps a person thrive? How do you really create winners instead of focusing on risks and disease? We've really taken this principle of self-leadership and pushed it beyond. And so additionally, what is it that you can do in the culture and environment? Dee talked about culture being so important. What are the kinds of things that you can do to help people not get worse? What can you put around them? And also, how do you help them become more strong self-leaders of their own destiny and their health? So determinants of health that really support a thriving employee are, some of them live with the individual, but there are incredibly important things around them, like the community, the workplace, and family and friends. And so what we're really building into our approach, and you'll be able to read about it in the book, are how do all these other factors support, and how can, taking the perspective of the employee, how can we help them become more engaged in each of these areas. We also are developing a living and thriving assessment that measures not only thriving in the individual, but also what they believe about the support they receive from all of these different areas. So this comes back into line with our Measure What Matters that we'll talk about in probably the next webinar. This is where we started years ago. So the dimensions for health, the continuum, really went from sickness to absence of illness and feeling okay. And then more recently, we pushed beyond that to a high level of wellness, but we're going even further with self-leadership and really asking questions about what it means to be a thriving individual and how can we sustain that thriving nature of individuals and support it in our workplaces. So what does it mean to really thrive? These are some of the notions that the concepts that we bring into our thoughts when we think about self-leadership: personal control, resilience, optimism, things like flow. What are your energy levels like, and what are the factors inside of the circles here are internal to the individual, but externally, what is the company providing and the environment and culture around them providing that really helps them become self-leaders, and it's a continuous process of learning and growing. It really isn't a destination, but how does your surroundings and what the employer can do for you really help you in that journey of becoming a self-leader? And one of the things that we're really bringing into play a lot is our values of the individuals, of the organization, across the entire organization. So sharing values is really important to supporting people across the organization, and we'll talk a little bit more later about how those come into play in a number of different ways. What kinds of programs and initiatives around helping people become more engaged patients, better consumers of their health care. What kinds of social support can we as employers help our employees go out into their environments with, and so better interact with their community, their family, but also bring it back to the employer setting and better interact with their colleagues and support each other. And then literacy and negotiation skills. There's a lot of different, Dee always puts, if you don't like the factors within the circles we have up here at the top, there are others we can put in there. It's really not a definitive list of things, but it's all those things that really help move a person to thrive in whatever way has the most meaning for them. So we actually have asked ourselves over the past few years, what can an employer do to really help employees move beyond risk? We have different levels of low risk or no risk. People who have zero health risks, the way that we've categorized risks and thought about risks in the past. There's almost a continuum of people in that low risk category. So how do we really put things into play? And there's so many technological advances today that can help bring some of the activities that we're learning about from science, that positive psychology, from positive organizational scholarship, and some of the areas of study that positive neuroscience that are really important to start bringing those concepts into the things that we provide for our employees to help them really thrive and become self-leaders. We've developed a set of online modules that we call a self-leadership project, and they look at resilience. So what is it that really helps you develop your own positive outlook? Nobody can do that for you, but there are activities in the module that it's interactive. They help you really go through this process yourself and engage in activities in ways that make sense for you to really start developing your own happiness. We bring into play brain health, how that is really an important factor in being able to really be creative and sustain energy. And there's so many really exciting findings in positive neuropsychology. In the self-leadership module, this is kind of the namesake module, we help employees build values. There's activities around building values, a statement of values, and how you live those values becomes, and to really live your purpose. So there's activities around that as well. Values and purpose are so important to an individual, whether or not you have stated them in the past or if this is an exercise that you're just doing. It's really, we feel, a way to put a stake in the ground about what you want to live and how you want to go about a life of meaning for yourself. And then all of the other things that we preach about in wellness really become means to helping you live those ends. So what is your vision for yourself? Change, helping people really understand mechanism of change, how do they really tackle change and what they can expect, resilience, all of these things really interact as well. So how can you tackle change by bringing in positive reframing into your life, creating change plans that make sense for you, and focusing on strengths. And as we work with individuals, focusing on strengths is very important, and then working with companies, focusing on the strengths of companies as well, we're finding is incredibly important. Finally, decision making. This isn't necessarily the kind of consumerism decision making that we think about. That's a particular area of interest of mine, but it also an area of interest is in behavioral economics. So how is it that we help people understand how their emotions and intuition influences the kinds of small and large decisions that they make every day, understanding the kind of mental shortcuts and biases that they use when we all use them. I mean, this isn't, we're not rational decision makers is the way we would really like to think, but we actually are subject to a lot of different things. Our decisions are influenced by things we aren't always aware of, and so rather than trying to, a lot of groups are using behavioral economics to sort of move people in a direction in an unfelt way toward what we want them to do. This is really trying to get people to be more aware of the things that marketing influences, the impacts that those have, and how do they really work around those or work with those shortcuts and biases, emotions, intuitions to really make the decisions that they're going to feel positive about in the long run.
Jennifer, let me say something here. I think
Sure.
Jennifer was intricately involved in doing these along with Angela. They worked on these modules along with me, but these are things that I think are beyond low risk, and I think that what we've learned over these last 6 years, that these are really important kinds of things. Along with the next 2 slides, you'll see some other topics that are just as important. And these are life skills. And I think many of the things you're seeing here, those they lead to disease. They lead to presenteeism. They lead to absent data. They lead to life satisfaction, quality of life. And that's what wellness, I think, can really make a difference in people, as well as not going to stop doing the risk factors and so forth. But these are risk factors also. And I think this is something that we need to pay much more attention to, and I think we are in general in this field. So here's some more. Go ahead, Jennifer.
Yeah, we're adding all of these into our thinking. So really, how do we look at health and define health in a much broader way, and also in a deeper way? So how do we expand the different kinds of domains that we think about when we think about health, and then how do we expand the dimensions of each of those domains in a positive way, especially? And then what can we do to really help people to learn from the science of positive psychology and some of those other positive sciences to help bring those into play to help people thrive and flourish? How do we, one of the things I'm finding really fascinating, we all are at Eddington, is how do we put the factors into play, into place physically and more broadly in organizations to help people find flow in their work. And flow is a concept that is we're starting to see much more, and we're learning a lot about how all of these things impact health, as Dee said. So positive organizational scholarship. So really, we're digging into self-determination theory, behavioral economics, as you saw those. We're bringing those into play those factors into play in our modules, and also other ways that we recommend the companies work. So new methods and measures as well. So part of our measurement and method is to start with that framework that Dee talked about. So really measure what matters, measure these positive characteristics, and then also look at them in the context of how they interrelate and which factors drive other factors, and then what parts of your program really drive each of the different kinds of outcome dimensions. We're back to the self-leadership modules. Those actually are part of how we measure. So in those modules, there are questions that kick off the module and then wrap up the module that help us know whether the people are moving along in terms of their understanding, their own self-leadership. And this is one way that companies can kind of dig into through tools like this that are online and interactive and ongoing to really follow how the efforts that they're making to help support their employees, how they're doing. So these kinds of measures you see, there's a lot of new validity research out there about measuring these social concepts, which are not always as widely accepted, but they are. My background is in social psychology, so I grew up with those. But for some of the folks who grew up in wellness, those don't hold as much rigor in their minds, but we're finding they can be measured in valid ways. This is one of the interactive activities. This one is around values. So what are your values? There's sort of an infinite list of things almost that you can choose from, but you can also choose your own values and then hone down to what your really clear top 5 values are. And then the tool helps you really create a statement about your values that if I live in this way, I'm living my value of authenticity. So it's a fun activity. Margie Blanchard Ken Blanchard helped us pull this together and put it in our module. So it's really kind of a neat new way of looking at helping people to really that goes beyond just the usual diet, exercise, smoking, that you can certainly tie, if I diet, if I quit smoking, I can live my value of family because I'll have more energy and so forth. Pillar 3, this is the levers of success that Dee continues the series of slides that have this framework. So promoting self-leadership really helps people thrive. It really helps. We believe it will help the programs that you have in place. Then it'll help folks use those programs in a deeper way, and it'll help people stick to the changes that they make. And it'll also help people understand how their behaviors and their self-leadership supports the vision of the company, and ultimately will impact the company's bottom line outcomes. Not only the below the line outcomes like cost savings and the ones that we always think about and focus on, but the above the line. We'll talk more about this next time. So how does a more creative individual lead to better products, better services, and reduce the kinds of things, costs associated with recidivist, losing employees and then having to rehire.
Yeah, Jennifer, I think we'll stop here. We'll pick up next week right here, and then go on into positive health. I think we want to leave some time for questions, so that well, maybe we could do this one, and then we'll leave measurement for the second week.
Well, I'll make a few comments, but then it would be great, Dee, if you could talk about this one as well. So this is, you see, we've highlighted systemic and sustainable. These are some of the S's that we talk about that really will help your initiatives really help impact in the most effective way. And so to really bring it into the systemic level, how do you really put practices into place that truly reinforce from the perspective of intrinsic motivation, less reliance on extrinsic motivators? How do you bring into play the actions of leaders and managers and colleagues that can really support each other and serve as motivators and reinforcers? So those are among the ways that we're growing in the way that we talk about Pillar 4, which is recognition. Do you want to jump in and wrap
Yeah,
this up?
this the way we look at Pillar 4 and recognizing positive actions. I think there's a lot of ways that are going on in the field right now that I'm not really pleased with. I think that when you get up to $600 for incentives just to participate, and even if you have $600, you have to make changes in some of the biometrics. Those are really getting to be very intrusive, and I think that we may find that it's going to backfire, because I don't know how much further the companies can go with that. It's gone in the last 5 or 6 years. It's gone from hats and T-shirts up to $600 per person, and that's just not sustainable, that kind of a rate of increase. But I think we can look, if we do it right. I think that this recognizing, and that not be financial, but it can be financial if you do it right. If you do it financial, I think it should go into HSA accounts or into retirement accounts. And then the people save income tax and the company saves payroll tax. So then you get them into something where we really know Americans need help in healthcare costs and in retirement. But these kind of actions, it reinforces a healthy well-being behaviors. It promotes shared values and develop intrinsic motivations where we need to get to, and promote self-efficacy. So I think those are the first 4 that we've talked about, and the first 4 pillars. We'll talk about measuring sustainable next time. We'll start out with that and get then into positive health. One thing I want to point out what we've done, this is not changing wellness at the margins. This is changing wellness as a field of getting more into people and what their internal motivations are and their emotions. And I think we got to do both. We have to do we can't stop doing what we've been doing. I don't think that's not an option. We can't stop having people be active, people thinking about what they eat, thinking about we're more into what they do in stress in this new field. Stress, and we're fighting boredom, we're fighting people getting burnout. Those are where I think the issues will come in the next 10 to 15 years. And we need to face that, but we got to do both. So our value to the organization is increasing every time. We're not going to get into our organizational development. That's not ours. We're not going to get into human resources. That's not ours. What we're into is health. And how do we impact health? And how do we impact people's functional ability to get around and so forth? Okay, I think we have 8 minutes left, Michaela.
You are right.
Okay.
And thank you so much, both you and Jennifer. Excellent and ton of information for sure. I guess relating to what you just said, a lot of people have gone down that, no longer T-shirts and hats, but $600 rabbit hole, if you will.
Right.
How can employers turn that around? And the $1 million question, I suppose.
Why don't you give somebody else a chance to answer a question?
Oh, yeah.
Yeah, no, that's the question I get every time, and that's really a very, very important question. I think all the questions you're going to ask are important, but that one is people are worried now. How do we get out of this? And what does it? If you go the second year, does it have to be more? Can you ever go back? I think Key Bank, had a good answer to that, and that's what, and it happened to be what I agree with. I think that you can put them take the money and they cut it down a little bit, but put it into health savings accounts. That's a tax-free money for you, for an individual, and they can use it for health-related issues. And then you can take it with them when they leave. And then, or if you don't have that option, put it into retirement accounts. The same thing, it's tax sheltered. And then the organization saves the payroll tax on it. So I think there's somehow somebody has to come up with a way to keep motivating people, but not make it cash. You know, it just, the more extrinsic motivation, the less the intrinsic. That when extrinsic goes up, intrinsic goes down.
Mm-hmm.
And when I ask people, are you in this for extrinsic motivation, or do you think the long term is intrinsic? And everybody says intrinsic. They have to get to where they want it themselves.
Hmm.
But if they keep doing it from dollars, you're mixing the messages.
Hmm.
So I don't have an answer to that. I would like to have an answer to that, but the best answer I can have now is just put it into tax saving accounts.
Yeah, that's a real good solution, though, I think. I hope. Are there case
Yeah.
studies out there, do you know, of people who have done that?
Well, I'm going to present with the key bank people with the National Business Group on Health it's a wellness, corporate wellness conference in September.
Okay.
And we'll talk more about that at that time. But I think it's only recently have people been worried about that, because they've just been pouring money into it, and now when they pour so much money, now I'm getting questions. Only just recently, in the last 6 months, I've been getting these questions, and I think so. I don't have any case studies that are really good for us right now, but we're going to get one in a new book, at least one.
Okay, good. I think that'll be, if nothing else, and certainly there is a lot more, that would be worth the cost of the book.
Yeah, right.
Amy's wondering, when is the book going to be out?
Yeah. Well, my wife is asking that too. When's that going to get done? We're thinking about mid-July to end of July, and I think that's probably a pretty hard number now. I've said March at one time, and then I said April and May, and so but I think mid-July.
Okay.
That's what I've been telling people now, and putting my feet in the water, and it's boiling hot water.
Well, you say it enough times, and you'll start to believe it yourself.
Right. And I should ask Jennifer that question. She's the one that's slowing me down. Slowing us down. No. Okay.
Okay, let's see here.
I'm just stunned.
I'm sorry?
Say again, Jennifer.
Oh,
I'm sorry. I was just my mouth agape here.
Yeah. Okay.
I'm kidding.
Yeah, she was probably writing. That's the reason.
Yeah. Well, thanks for the pressure.
Yeah. No pressure.
Okay, Carol's wondering, what are the S's for success? Senior, leadership, systemic, and sustainable. Are there others?
Well, systemic, if you get into the culture, I think I know what the question is, or the area is. And the systematic, I think, is really a key one. That I think you can't, and I think we made this point many times, you can't jump right into the tactics and get people get active without telling them why are we going to do this, and then what are we going to do, and then how do we do it, until they get a vision for why are we doing this. They sort of give up. And some people will have, some people you say something and they jump right away. In fact, they're jumping before you even finish a sentence. Others are just waiting back and say, well, how's this going to change me, and how's it going to change my friends? And I don't know about this, if we should really do it. So I think that if we pay attention to those four areas, and they almost have to be systematic, and they have to have that vision. And systematic, you have to know where you're going. Systemic is where you do it enough, and then people will do it if you're not even there. That's when it shows you're into the culture. And then sustainable, getting people feedback. Those are the measures that we're looking to. We're working in every corporation, working to find those measures.
Let's see. Cheryl wants to know a couple different, wanting your thoughts on a couple different strategies. Um, what about premium differentials? Because it
Mhm.
isn't exactly giving them money.
Well, yeah, I guess it's sort of a white lie. Uh, uh, if you are totally transparent with the employees, I think it's okay. If you're not transparent, then you're not being truthful with the employees.
Hmm,
Because
good
some
point.
people just jack up, and benefit director and benefit consultants led the charge on this. You just jack up the premium, and then you say that's what the premium is going to be next year. And then, but we're going to be so friendly that if you do what we want you to do, what these things, we'll move it back down halfway down or something like that.
Hmm.
And some companies actually make money on those premiums because some people don't do it. So the people that don't do it pay for the program, which is, I know that's a strategy that some people use. I think it's, unless you are totally open and make sure everybody knows. Just say, well, we sent that out in a memo, 3 weeks ago. Didn't you see
Hmm.
it?
Hmm.
But if you make sure everyone knows and everyone buys into it, then I think that could work. Uh, it is better than just cash, no question about that.
Hmm.
And if that one might be a step towards maybe what you're saying before, I mean that's a step towards getting on to HSA or someplace, or
Hmm.
getting out of the cash business.
Hmm.
There may be
Yeah.
some way to do that. It really depends on the organization. Penn State got into a lot of problems with that, and finally their employees revolted, and so a lot of people have been in problems with it.
Hmm.
That's the rabbit hole you're talking about.
Well, we have some other questions about self-leadership modules. Are they available for sale? And some other things. So I'm going to send them to you
Okay.
so
Yeah.
that you can reply
Yeah. Maybe next week.
offline,
Yeah.
and maybe you could answer them online because there's probably more than one person wondering about that stuff.
Okay.
So that might be a good way to go.
Okay.
So thank you so much. It was awesome. Lots of good questions. I think everybody was pretty well right there with you.
Oh, good. Well, thanks. I appreciate being here. And I'm looking forward to next week too.
Yep, me too. So thanks everybody for
Yeah.
being
Okay.
here, and thank you and Jennifer. And I will see you guys next week.
Right. Bye bye.
You're welcome.
Take
Thanks,
care. Bye
everybody.
bye. Have a good weekend.